A quick note before we begin. This podcast dives into real, often raw conversations about life's most profound moments, from a labor's beginning to life's end and all the complexity in between. Some stories may be emotionally challenging or deeply moving. Please listen with care and know that you are not alone. Welcome to the Mamatoosa podcast. I'm your host, Atusa Benji. Hi, Sondra. Good morning.
Good morning.
Thank you so much for being on the Mamatoosa podcast this morning.
Yeah, thank you for having me.
It's good to see you.
You too.
I'm interested in spending the hour with you because you and I have spoken at length about your postpartum experience, which you graciously shared with me and with, I think, one or two of my classes of one or two of my trainings, bringing light to the tremendous challenges that you faced in the postpartum period. For the listener, when we speak about the postpartum period, especially as it relates to mood and anxiety disorders, they can happen anytime from the moment of conception all the way to 3 years after birth. So when people speak only about postpartum depression, or they say postpartum doesn't actually refer to what is happening inside the person. Postpartum is a period of time, post meaning after, partum meaning birth. So literally to say postpartum means after birth. So many times we are using the word postpartum depression as a misnomer, because many people are actually not experiencing postpartum depression. And for the person who's going through whatever they're going through, postpartum depression can actually be very confusing because of A, the stigma people have about depression, but two, the notions that people have about depression. Like, no, I was able to shower. No, I was able to get out of bed. No, I wasn't in bed with the blinds closed and the sheets over my head and not able
Right.
to eat. And so people suffer in silence because it's not really taught to us so much that perinatal mood and anxiety disorders can cover a gamut from feeling low to psychosis, obsessive compulsive tendencies, tremendous anxiety, and sort of everything in between. And to be clear, people who have babies can go through baby blues. Right, we know that, where you look at your baby and the tears come down. Or you're like, I don't know, I remember I watched a ballet after I had given birth, and I was like, this is so beautiful. There's so much beauty in the world. I really don't care about ballet at all.
Right.
But I'm like, what is going on? And it was like day 8, totally normal. So by 2-3 weeks, but those baby blues should be sort of going away.
Right.
But many people experience debilitating fear, debilitating anxiety, intrusive thoughts, suicidal ideation, thoughts of hurting the baby, and at the worst, when it gets to the point of postpartum psychosis, hallucinations and thoughts of someone talking to them, telling them to do something to themselves or to the baby for whatever reason. So I know that you have been a champion of speaking up about this, and I wanted to speak to you a little bit about your journey. Tell me about your pregnancy, your first pregnancy.
Yeah. So, that was such a beautiful explanation in short. I mean, there's so many pieces to it, right? So I have 3 babies. So I had 3 pregnancies, 3 postpartum sort of periods that I consider, they were all 3 very unique. My first pregnancy, I mean, the pregnancy itself was, I mean, the very layman's term is fine. I mean, I had the sickness and everything. My first delivery, there's the nerves and everything. I went into labor naturally. And then my first delivery, I don't know if you remember this during our training together, I had a postpartum hemorrhage with my first. And I did not realize how much that affected me for years. I ended up doing EMDR trauma therapy about it later. But what was so fascinating was during the experience, I never really quite understood what happened to me because no one was explaining it to me at the time. The doctors and nurses were doing their job. They were literally saving my life. But it was during your training, actually, you were explaining what a postpartum hemorrhage is. And I just went, whoa, that's exactly what happened to me. It was so interesting that no one ever really took the time to explain what was happening. And so that really sat with me for many years, just living as trauma in my body. And thankfully, I'll get to this later, but I have a wonderful therapist who went through all of this with me. But that really affected me in the postpartum period tremendously. I would say I had the baby blues for sure. And I personally take some issue with the name just because it's so cutesy, even though, it can be, kind of debilitating, and there is a normalcy to it, right? But, the crying, I remember same thing. I cried because I couldn't plug something into the wall, or I don't know. I remember I called my husband just crying. It was like a week in after my first, and he's like, there's an extension cord. And I went, oh, yeah, okay. It was just such a simple thing, but it was just like the end of the world to me. But that postpartum period, I would say, baby blues primarily, but I did have this kind of underlying trauma that stuck with me. And I wouldn't say that I wasn't diagnosed and I didn't feel necessarily postpartum depression or anxiety with that one, but it definitely came in stronger the second and third time.
And for our listeners, the definition of a postpartum hemorrhage is bleeding that occurs after the birth of the baby, whether it's before the placenta delivers or after the placenta delivers, or it can actually be within a few days of having given birth. Postpartum hemorrhages can occur and can be very, very frightening because the body can literally turn into like a Niagara Falls of blood gushing out of the vagina uncontrollably. And so when it happens in that immediate postpartum period, typically nurses and doctors are in the room, and midwives are in the room taking action very quickly, which can involve setting up an IV for fluids and medications, maybe giving the client a shot in the thigh, giving the client sublingual or medication in the cheek or even in the rectum to see if the bleeding will stop. And also this very aggressive massage on the uterus to try to get the uterus to tighten up, or a manual removal of the placenta, because sometimes when the placenta doesn't come out, you have to get it out to allow the uterus to hunker down and stop the bleeding. So you can imagine, for someone who doesn't know what's happening, they've just given birth, this beautiful baby, possibly a glorious delivery or not so glorious delivery. Either way, when you think you're done and then you see medical staff running around saving your life, and the sensation of blood leaving your body and the reaction of those who are watching can be really, really debilitating. And also, when you lose that much blood, you are losing the vitality in the body. So that's not conducive to feeling physically well, because you could now have become anemic. Your blood count has gone down, your hemoglobin has gone down. There's literally not enough oxygen getting to your brain, and your body feels weak. So it really is a perfect storm of setting you up for not feeling great emotionally, spiritually, or mentally either. So that trauma stayed with you.
Yeah. And, I will say, there was just a lot. They came and took the baby off, and they gave me a shot, and they were running around, and they did have to manually go in for removal. And so, what's interesting, I'll just tell a side note for that. I am a doula now. You trained me, and I'm a certified doula. So and I did have a client who had a postpartum hemorrhage, almost identical. And it was this really, kind of ultimately beautiful full circle moment. She's fine, baby's fine, everybody was great. But I was that person just sitting next to her, just explaining what was happening, which is really what I think I needed. I couldn't tell her everything's great, it's fine, but I just explained this is what they're doing. That, they have to be doing this right now. I know it's uncomfortable, and, just sort of explaining the steps. Again, what I wish I just had. So I just knew, so I understood. And again, I don't fault the nurses or doctors because they were doing their job, but it really was pretty incredible. And, I did have a lot of, the postpartum period, I was very weak and tired. They had essentially said I was past the threshold of needing a transfusion, but I remember I was just laying in the hospital bed, and they're like, well, do you want one? You need one technically, but you're healthy. And I was just sitting there like, I don't know. What do you mean? And so I opted not to. But so, I was able to explain that to my client, which was really a very full circle moment to be that for her. But anyway, from my own experience, that affected me for months of just feeling very weak and not quite myself. But even still, I would say that was my best postpartum recovery, and maybe it was just sort of layered on, and I didn't realize that it was sitting with me because, again, at the time, going back, I didn't quite know what happened. I just sort of wrote it off, and because no one explained it to me, I thought, okay, I guess it's just something I need to get over. And when it came time, when I was pregnant with my second son, closer to birth, I started getting a lot of anxiety. And I remember just asking my husband these questions like, we need to decide if you have to choose between me and the baby. We have to decide now, what that choice would be if I can't speak for myself. And he was saying, where's this coming from? And I just kept saying, I'm just really nervous this time. And, looking back again, all these images were flashing in my brain of the nurse looking at my body, seeing the blood come out her face was very vivid. Just the feeling of my baby being taken away, off my chest with no explanation, and all these things were, affecting me. But again, it was very subconscious. I wasn't very aware really of why I was so nervous and why I was so anxious. And so I think that definitely led in, the second time I opted for an induction, which looking back, I think was my way of feeling like I had some control. And the induction itself went fine, and that delivery was fine. Everything went great. It was actually very quick, thankfully. My second one, I only pushed for 3 minutes, which I think is pretty impressive.
Second babies have the magic potion.
Right? I was like, we call him our wild card because the last few weeks, he was so low. The doctor's like, he's just going to fall out. But it was like, just walking, I couldn't even close my legs. That was so just uncomfortable. But then he flew out. So he's always kind of been like our Sour Patch or Sour Sweet kid.
I love it.
Yeah, he's so funny. But anyway, so delivery was fine. But with him, that really led into, it's hard to say exactly because I did end up seeing a therapist, and I was diagnosed with postpartum depression with him. His postpartum period was really just dark thoughts, feeling very alone. My husband's job also, he's in the Coast Guard. So at the time, he was in a position where he had to leave for a few months at a time. So he left when my second was not even 3 months old. And I just got hit hard. It was like, I thought I was going to be okay. I was just going to tough it out. I had a toddler and a newborn baby, and I just got, destroyed really. I was so down and low, and I did seek out a therapist who, looking back, I didn't realize she wasn't perinatal certified. And so it was nice to have someone to talk to, but, I later found a therapist who is wonderful, who I still see. And I can see the difference now of somebody who understood specifically perinatal mental health versus just, it was a lot of, you're doing great, just keep going, keep doing what you're doing. And I was thinking, well, I'm sobbing in my car before I walk in here, and then I'm sobbing after. Like, this doesn't feel like I'm doing well,
Sondra,
and then there was a lot of...
Did you already have the relationship with the therapist set up, or you sought a therapist after the birth?
It was after. So when my husband left in the beginning, I felt okay. I felt like stable. And then I'd say about a month in, it was a very different story. And, it's hard. It's kind of blurry. I think the brain kind of has difficulty retaining a lot of memories when you're in that state of mind. But for me, I just know it felt like I was just kind of living in a dark cave all the time. And my husband came back for about 2 weeks in between his patrols. And he came back and was like, we're finding you a therapist, because he knew something, he knew I wasn't okay. And so he really helped me. We did the thing, which we ended up doing again later. I'll get to that. But, kind of cold calling and finding people. And I have a friend who's a wonderful social worker. I reached out to her just because I really didn't know who to go to. You call your insurance and they're just kind of like, here's a list, I guess. There wasn't really a place to go to say, I'm struggling. Can somebody help me find someone? So thankfully my social worker friend, really helped me find some resources and got me connected. And so I found someone that way. And again, that person was, I just don't think really qualified for my specific needs. So we did, it was into really, I was already pretty far into the depression by the time I started seeing her. And, it kind of just tapered off, I would say, with her. There wasn't really, I didn't feel like there was ever a resolution. It was more like my husband finally came home. I just feel like, that whole period, it was probably about 4 months. I don't have a lot of memories. I just remember crying all the time. Very sad. And it really, I have a lot of grief now looking back because there's so many memories I wish I could have kept with my babies, these moments that I'll never get back with them, these, those newborn sweet moments. And so, yeah, it was hard. And I have, moments where I remember my newborn just crying and I was just crying with him, and I was, doing everything I could because I just gave everything that I had, the little bit that I had, into being a mother for them, making sure that they were okay and that, and now I understand how to talk to them, how to explain to them if they see me having a hard time. At the time, I was just not myself at all.
And so there's a toddler and a baby, so they were littles.
Right, yeah. So I couldn't explain to my newborn, like, I'm suffering, he didn't know. And my toddler was barely 2, so he's little, and so it was hard. And I, again, my therapist, my ultimate therapist I ended up with, we retroactively went back and really worked through a lot of that together. But at the time, it just felt like very hopeless because even though I was seeing a therapist, it didn't feel like it was helping. In fact, it almost made me feel worse because they were saying, well, you're doing great, just keep going. And I just thought, this is what great is? I'm not okay, though. There's no tools, there was nothing other than just sort of keep going, which felt really difficult to do at the time.
So I can imagine how that could also set you back because a professional is now telling you that you're actually okay and keep doing what you're doing and you're good. So the space that you're in where you're like, well, actually, I'm not doing very well. And yet you're telling me I'm doing well, which might actually make you feel worse and confused, I would imagine.
Yes, very much so. I was very just kind of, I don't know, I just remember crying, like I said, crying in the car before I got there and crying after and just thinking, okay, I guess this is just, there was a lot of mentality around me where it was just kind of like, this is just the way it is. Everybody goes through it kind of thing. And yeah. I actually had comments from family members. I remember it was hard to open up to anyone because, again, in that space, it's hard to know who to ask for help or how. I struggle with that anyway, but especially then. And I made a comment to a family member, I think I said something like, I just feel so exhausted and so tired and sad. And then the response was something to the effect of, well, we all went through it. She was a mom as well. And it was just kind of immediately felt shut down again, kind of, okay, I guess this is just...
It's just the way it is.
Just the way it is. So we all just suffer then, It just felt like, this doesn't seem right to me.
And what were your symptoms, Sondra? The crying, the sadness?
Yeah, it was a lot of crying and sadness and just really a sense of hopelessness. Mm-hmm. I remember describing to a friend, it just felt like I'm in a dark cave and there's no lights on. And once in a while, maybe a little light comes on, but then it goes back on. Like, it just felt like there was nothing around me that I could hold on to stay afloat. And so every day was just sort of survival mode. I was just making sure my kids were safe and okay. There was no self-care. There was no, I lost so much weight. And people would comment, and that was the other thing. People would comment, oh, wow, you bounced back, you lost weight. But they didn't realize because I wasn't eating. I wasn't okay, And so that was another thing, the reinforcing of losing weight is a great thing after you have a baby. And I had an older gentleman that my family knows and commented something like, wow, good for you. You lost all the, and I just remember thinking like, what, And in my head, again, it was so confusing because I knew I wasn't okay. I knew I wasn't eating because I was so depressed. I was truly like barely eating throughout the day. All my clothes were baggy. And I remember one person specifically, a kind of distant family member, saw me for the first time. And she was the first person that sounded concerned. It wasn't, wow, you lost weight. It was, you're so thin. I've never seen you like this before. And then someone else came in and went, yeah, she bounced, and immediately kind of cut off that concern. And I just thought, wow, nobody sees this as a problem.
Yeah. And yeah. I think one of the most powerful things that I experienced one time during a weight loss journey was when not even someone very close, but very kind said, "You look great. Are you healthy?"
Mm-mm.
And it was just so, I get goosebumps just thinking about it, because weight loss in and of itself is looked at as such a win that rarely do people look beyond that there are many other factors for weight loss other than the person actively trying to limit calories and move more.
Mm-hmm.
And the fact that one person honed in on that and the other person was like, "Oh, doesn't she look great? Next."
Yeah.
Is really a testament to our society's delusion of why and how people lose weight and how quote unquote great it is.
Absolutely. Yeah. I recently, when I became a doula, I started connecting with other people in the birth world, and I connected with a dietitian, and she was so great. We had a wonderful conversation, and she very much talks about that, because her name, she's like, there's this stigma, dietitian, like, I'm going to give you a diet. And she's like, I want to help people with their relationship with their body, with their relationship with food. She's like, most of the time, I'm just making sure you're getting food in your body. And it's not about how you look, how your weight is. And that was just this huge, because I never really had a conversation with a dietitian, and I was just thought that was so powerful. And I was so happy to connect with her, because she's out there trying to help too, do from her perspective of changing all these narratives. But, when you're in that vulnerable time postpartum, I mean, women, I think all of us can understand that we've all faced the issue of body shaming and weight and all the things that we deal with as women. But postpartum especially, I couldn't even understand how much. I just remember thinking, wow, my pants are all of a sudden baggy. I look back at pictures and I just think, wow, that was, I was so thin and so frail. That's the way I saw myself. Not thin and hot or whatever. It was like I was frail. I feel sad for myself then, because I was so in the trenches of being lost, really. And again, other people just saw these symptoms of that and were praising it because of, the way society looks at our bodies. And yeah, so there was definitely a lot of that experience with the second one. It showed everywhere, the depression was everywhere. My hair was falling out. My skin looked awful. I was just, every part of me was showing. It was, my body, I think, was desperately trying to show the signals that I was not okay, mentally, spiritually, physically, everything. And again, I just kind of it kept getting buried more, because the few times I did sort of poke around, see if I could get help, the responses were not helpful. They made it worse. And so that really affected me, obviously. And I think that's a big part of what I do now, is really trying to go back in and be the person who is looking for those signs and not, furthering those negative stigmas, because it's so hard. It's so hard in that time. It's hard for all women, but it's hard, especially postpartum.
So you were working with a therapist who was not certified in perinatal care for women, essentially. And then what shifted?
Honestly, I don't remember why I stopped. I think it was something like she had to take time off or something, and then I just never reconnected. I don't know. It didn't really feel like something I needed. My husband came home, and he really, was a stable presence, which was very helpful for me, and very supportive and understanding of all the ways that I needed to recover. And he really became the voice of, all the ways that I felt like I wasn't being cared for. He really came in and helped a lot, and I credit him a lot for that. He was dealing with his own things, and he felt very helpless too while he was gone. But so I think that was probably a big shift, was him being home and present, and just having another parent in the house, another human adult in the house, but especially a parent, to be my partner. And he really took over a lot of the responsibilities so that I could sort of come back to myself. And it's hard to say exactly, I can't tell you the moment that I thought, oh, I feel like myself again, but it was a long time.
Did you choose medication?
At that point, no. I did not do medication at the time. And again, my therapist was like, oh, I don't think you need medication. And so I said, okay, I guess I'll listen to that. I did later with my third, but not at the second time. And, eventually I found out I was pregnant with my third, and pretty much like from that positive test, my husband's like, we are finding you a therapist. We're going to be proactive about this. We're going to make sure that, we do this differently.
We're going to clone your husband and sprinkle him around the city.
He's great. I know,
around
right?
The world.
I know, I am so grateful to him because he's such a great, he's my champion and supporter and everything. And, he was very on top of it, very much more. I'll explain more later, but he's always been, when I couldn't do these things, he showed up for me. And so I do credit him a lot for the support.
And his own constitution, because sometimes when mama goes down, papa goes down too.
Absolutely.
And so then you have this vicious cycle of no one's coping and no one can see the light and bad things happen. So the blessing that he was able to see through and be like, this is not the wife I know. This is not normal. I know her well, and I know that this is not my partner thriving, is a big testament to his constitution, but also his wherewithal of knowing that something in his house is not right.
Absolutely. Yeah. And he continued to be that way for me as things got much worse. But, I will say, there's also, just a side note, the stigma of dads, who can also experience postpartum mood disorders. And he really showed up for me, and we've had conversations since about, he eventually started seeing a therapist as well, because I said, there's no way all of this didn't affect you too, seeing me in this way, because I know he loves me, I love him. And it was really hard for him to witness these things. And as much as he showed up for me, he couldn't take it away from me. And I know that was very hard for him. And so, making sure that after all was said and done, him showing up for me, I said, we need to make sure that you're okay too, because dads can suffer as well on their own, or because they're seeing their partner suffer.
Absolutely. So you're now pregnant with your third.
Pregnant with my third.
You are prophylactically looking for support.
Yes. Yeah. So, and mind you, this is 2019, 2020, as we all know, COVID hits.
Yep. Not the best time for pregnant people, birthing people. Nope. Families.
Oh, it was, yeah. When you're pregnant, people treat you like, you're this glowing goddess. Sometimes they move out of your way. They open doors for you. And then when COVID hit, it was like, people looked at me like I was an alien. Like, what are you doing out of the house? I was all of a sudden, everything shifted. And so 7 months pregnant, the world shut down, and I didn't leave my house because at the time, we're hearing pregnant women are more vulnerable. And, this was pre-vaccine. This was right at the beginning. So I delivered 2 months into the pandemic, absolutely terrified that, hearing all these stories of, women who had to deliver alone because the partners weren't allowed in the hospital. And so every day I'm checking and texting my friend at the hospital, can he still come with, So there's this pre-fear going in, the whole world is suffering at that point.
And each hospital had its own crazy happening. Right.
Absolutely.
And it literally, I remember I was midwifing and I was mostly midwifing at that time. And we weren't even allowed to follow our clients in when they had a transfer from an out-of-hospital setting. So if a client needed to transfer for whatever reason, it was like, okay, bye, FaceTime us from there, because they wouldn't let us in. So it was a dark, dark time. And it seemed that every week policy would change. So Wednesday they would let you in. Then Friday you tried to go in and they're like, no, sorry, we're not letting anyone in. Then Monday it was like, well, show us your vaccine record. And Tuesday it was like, well, that's the wrong vaccine. And Wednesday it was like, only 2 people, only 3 people. I mean, it was crazy making. Mm-hmm. And for mothers, expectant people were losing their minds because there was no consistency in week to week to week what your support could be. And we know that when you give birth alone, you're already going in behind in terms of feeling stable, feeling grounded, feeling heard and feeling seen and feeling safe for you and your baby. Yeah. So it was a dark, dark time. It was a dark time in the world, but for obstetrics and families especially.
Yeah, it was. I had a friend who went in to give birth in March, right when it shut down. And that night she went in, they changed the policy. And so she delivered, I don't even know, let's say 11 p.m. And then the next morning they said, sorry, your husband has to leave. They just changed it. So it's 2 hours after birth. Husband's got to go. And while she was there, it was just, and so that was trauma for her, obviously. And she had the nurses, the poor nurses who are now running around trying to adjust to this new policy. It was awful. She had so many women, had so many of these stories. And there's a whole, I think, group of us who delivered during that period who have this understanding of just how intense and traumatic that was. And I'm grateful that, just my husband was able to stay with me And I had an okay experience. They definitely told me to wear a mask. And I was in labor. I was like, no, I finally ripped it off. I was like, I can't wear this mask. But, again, nobody really knew what was going on at that point. And, that's a whole other conversation. But it was very intense, and not knowing what could change and what could shift. But I will say, my daughter's delivery went really well. It was actually the one that I felt the most present for. And it was a pretty beautiful experience, the delivery itself. And I think I also knew, I knew that was our last baby at the time. So I think there was a part of me that just kind of was more present and aware. And so, at that point, we had her and came home, and I had already researched a therapist, and I had, picked out one that was perinatal certified, and everything was virtual, right? So, we're doing our sessions through, the computer screen, which was okay. And I'd say pretty quickly, we honed in on a lot of that trauma that, and I can't even remember how she's so great at what she does, but, I made a one-off comment. She said, well, let's talk about that. And then she really was able to kind of dig through and say, there's a lot of trauma here sitting in you right now. And I have my newborn, I'm breastfeeding on Zoom with her. And she said, if you're open to it, we can work through a lot of this. And so we did. We started working through a lot of that. And so I'm not sure, at what point things shifted, and it could be maybe from digging all that up and really kind of retroactively going through in COVID. All these things, I think, created this perfect storm of everything bubbled up to the surface. And so with her, I know I say with her, I have the postpartum, I talk about my children, obviously. I don't blame my children for,
Right.
that's just how I identify which, baby I'm talking about,
Yes.
which postpartum. So with my daughter's postpartum, like you said, it can happen anytime. And so it wasn't immediate. Hers was about a year postpartum when things really, really got very difficult. And again, I had my therapist, and that was consistent, and she's continued to be great.
Was there something that happened a year in, or do you think it was just hormones or breastfeeding?
I think it was both, in my husband's job. And I think the combination of really kind of going back through all that trauma from before, and while dealing with it, you are also bringing it to the surface.
And we're in a pandemic.
Yeah, and we're in a pandemic, and, I had this baby, and now I have 3 kids who are all wonderful, but, it's just, so there's a lot of factors. I think individually I could probably make a chart of all of them, but there wasn't one specific event that I could say that's what really caused this. But there was one event that I think shifted and changed the trajectory of my own mental health in terms of, I can pinpoint the day when things shifted for me. And that was, again, my husband he would be gone for a few weeks at a time. So it wasn't, a month's long span, but still a long time when, you have 3 young kids. But we were adjusting, and it was still hard. And this one time, I would get migraines very regularly. And that causes a lot of stress, because the migraines would be like 2 days of me just being incapacitated. Really, I couldn't have the lights on. I was, thankfully our parents are in the area, and a lot of times they could come help or pick up somebody, or, drop off food or something. But it was still really, I knew as soon as I started getting one, the stress would escalate of, oh no, here it comes, I'm alone. But this one night, I remember I was actually here in this bedroom. I had all my kids sleeping with me, either in the bed or, a little bed on the floor or something. And, it was an hour passed, another hour passed, and I was feeling very anxious. At some point I realized it had been hours and I wasn't able to sleep at all. And I started thinking that if I fell asleep that I was going to die. And it just kept going. That escalated more and more to the point where I was pacing around my house. I was just terrified to lay down, because I thought I can't go to sleep because, and I, apologies, it's a little bit of a trigger warning, but I just had this very vivid image in my mind of my children, my little babies, waking up and seeing their mother's body, and nobody was going to be here to help them because they didn't know how to pick up my phone and make a call. They were little. And I thought, no one's going to come check on me. They're going to be alone. They're going to need help. So I started sending my husband, who was on the ship at the time, I couldn't call him, emails. I was just explaining this, I guess. That was my logic at the time. I need him to know so that he can make sure someone checks on the kids in the morning. And so I, later realized I wrote him like 8 emails that night, just really just kind of frantic. And the next morning he was able to get on an emergency phone and call me, and he said, you need to go into the ER or something, like, you're not okay right now. please call your family. And so, at that point I hadn't slept all night, and I was just very, just really, the only way I could describe it is out of my mind. I was just so scared of everything at that point. I called my family, and my dad showed up, and he, for the first time, explained to me that he also had an anxiety disorder, and he had Klonopin, which is a medication that can be used to treat anxiety disorders. It needs to be prescribed. Don't recommend doing what I did, but he gave me one, and I was so desperate to not feel that way that I took one. And so that was enough to calm me down. I basically fell asleep, and he stayed there, and my mom and sister showed up, and they just watched the kids while I slept. So that was really, like I said, that defining moment, because that was just really the beginning of this months-long experience of essentially, I think it was kind of teetering on postpartum psychosis. I wouldn't say I had, the hallucinations that you described, but it really was kind of this delusion of thinking that something really awful was going to happen to me and really vividly believing it. And now I can sit here and tell you, obviously that was not what was happening, but in the time, your brain really can convince you that that's what's happening. And so it made me feel so scared. And then I started feeling guilty because I thought, oh my gosh, I can't show up for my kids because I'm not, it just really spiraled. I spoke to my therapist, and, she's not qualified to prescribe medication. But at that point, it was very clear that I needed something to, the chemicals in my brain were not functioning correctly. And up until that point, I was really, I wouldn't say anti-medication, but I wasn't really considering it. And at that point I said, clearly something's not right, and I'm open to that if that's what I need.
And how old was your baby at this point, the youngest? She
was, I think, right around 1, maybe just before 1, right around then. And my oldest at that point was, I think, 4. They were all so little still.
So little.
And so I really started desperately looking for help. Again, we're in the pandemic, so at the time, the doctor's office that I had, they weren't seeing patients in person. You could only talk to the doctor on the phone. Called them, left them a message, didn't hear back for a couple days. This is at this point I started having panic attacks within that first, I'd say 24, 48 hours of that experience, which at the time I realized now was a version of a panic attack. But then I started having the more traditional, typical panic attack of, the rapid breathing. Really, I couldn't function. Sometimes I thought I was going to die because it felt like my body was failing. It was about, 20 minutes at a time, but I was having those throughout the day. So in between those, I was trying to figure out how to get help. So they didn't respond. I ended up going to urgent care because I didn't know where else to go. And they essentially said, we don't really treat this here, Yeah, they really, truly, when I called and I was sitting outside of my car, waiting to go in, again, pandemic, and the receptionist says, we don't really do that here. We don't treat that here. And I said, can someone just talk to me, please? So I went in, and it was a registered nurse. And I remember I was having a panic attack in the office, and she was saying stuff like, okay, I can see that you're in a crisis. And I don't know if she was talking to me or talking to herself. She was kind of like trying to figure out what to do with me. She's like, okay, you're in a crisis. I see that you need help. It's an emergency. And so she, mid-panic attack, she goes, okay, well, I can either give you 3 Xanax or a month-long prescription of this other stuff. I think it was Buspirone or something. She said, what do you want?
And anxiety medicine. And just to be clear, we're not promoting any specific medication. We are not experts, psychologists, nor psychiatrists. We are just speaking about one person's experience. So talk to your healthcare provider about any meds, please.
Of course, please. Yes. I'm just telling you what they offered me. I'm not condoning or supporting any of these. And I didn't even know anything about those at the time. Again, a mid-panic attack, and she's offering me these 2 things. And I had heard of Xanax, and then the stigma of Xanax, of it being addictive, and there was only 3. So I thought, okay, well, I guess I'll do the other one, and so they prescribed that to me. And I remember Googling it because they didn't really tell me what it was or what, and again, I don't want to speak on the specifics 'cause I'm not a medical provider, but when I looked it up, it just didn't seem like actually what I needed. And it was, so it was meant to be a more long-term, I think, medication, and it didn't help me in the immediate term. And so I thought, I'm not going to just keep taking this. I don't know what it is. And it's not working right now. After a few days, it's not helping. If anything, it felt like it was making it worse, and so I'm still trying to get a hold of my primary care doctor. They finally call me back, and it's a nurse, and she says, well, we have an appointment 3 weeks out. where you can call your doctor. And I thought, 3 weeks, okay. Nobody can help me now, and they said, no, sorry, this is all we got. And so I also had sent a message to the doctor, and, I think a week later she replied and just kind of blindly prescribed me. It was an antihistamine type medication that can also help with anxiety. So she blindly prescribed that to me without speaking to me.
Wow.
And I took, yeah.
And in that time, you could have died.
Yeah.
You could have died. So appointments being given 3 weeks out is when we lose people.
Absolutely. Yeah. And I also, I look back at that time and I think, for me, I was in the position of having family members nearby that I trusted with my kids, because I really was not okay enough to even really actively, presently take care of my kids. So my mom really took in my kids for a lot of that time, and they were staying there for nights at a time because I just felt so unstable, and I didn't have any feelings like I was going to hurt them or hurt myself, but I did not feel like I could function. I mean, I was having these panic attacks where I was on the floor, unable to move. And I have an infant and 2 toddlers, and I can't get up if they need me in that moment, And so they really, all these things were piling on top of each other. And so I think about how lucky I was that I had support. And I think about, mothers who experience this without that. And I just can't even imagine that, because really I think if I didn't have that support, I think it would have gone much more south. I think, like you said, you can lose people at that point because it was so stressful and debilitating, and I was so not myself, and these thoughts were so not anything I'd ever experienced before, and you can see how it could escalate to that point. And so thankfully I did have someone who could care for my kids in a way that I trusted, because that alone I think would have, it would have been just too much to think, how am I going to take care of my kids when I can't even get up off this floor? And so these appointments were far out. She prescribed me something, and I remember I took it, and it was, I don't know what the dosage was. Again, it was an antihistamine, but I slept for probably 14 hours. And I remember thinking, I can't live like that. I can't take medication that literally just makes me sleep. That's not the solution to this. And I felt groggy and weird. And at that point I realized I was just getting these sort of random prescriptions from people who weren't actually sitting with me and listening to me. And around the same time, my husband, he's aware of all this that's happening, and he's sort of panicking in the ocean, and they actually sent him home because they found out what was going on. So they got him on a plane and sent him back so he could be with me and help me. And so he starts cold calling psychiatrists that take our insurance. I think we got a list of like 15 names, and I think of all the 15 that he called, one called us back. They were either didn't answer, or they were deceased, or they didn't take our insurance. It was like this list that was so unhelpful. And the one that called us back, they had an appointment like 2 months out. So he made it because he's like, that's all we have. Let's just take that, whatever. And all this while I'm talking to my therapist, who's been great. But, again, she can't prescribe anything to really fix, the chemical imbalance that's happening. And so she basically says, she's like, I know personally some psychiatrists, they do not take insurance because insurance can make things very difficult for providers. She's like, but just so you know, there is this option of these psychiatrists who will sit down with you and spend time with you, and they will really take care of you. But I understand it is, you're paying out of pocket for this.
Cost prohibitive for many.
Absolutely. Yeah, you realize how hard it is for providers to accept insurance because they make it so difficult for them. And, again, we're in a pandemic, so everyone's struggling.
It's a broken system on top of a broken system now.
Completely. Oh, completely. That's a whole other, I could
a
go
whole
on
other, yep.
Yeah, that could be a 10 other episode podcast. But so I finally called the one that she recommended, and that psychiatrist called me back same day. And I spoke to her, and she said that her client list was full, but she said she knows my therapist and she understood my story, and she said, I want to help you. I'm going to take you basically as an extra add-on patient, because she's like, I hear that you're suffering, and she's like, but I still, she didn't even have appointments for, I think, 3 weeks out, but she's like, I'll call you if there's a cancellation. But it was the first person who I spoke to who really acknowledged me as my own individual person and not just like, a number on a list. And again, it's the system that's broken. But so I ultimately, 3 weeks went by and I was having multiple panic attacks a day, all these medications that are floating around my house that I didn't even know what they were. And I wasn't taking them anymore because it just felt too strange. They either didn't work or they made me, and it just felt so strange that was acceptable to just be prescribing all these people who didn't know me. I hadn't even seen them or met them. And finally, I did speak to the psychiatrist, and she sat with me, I think, for like 2 hours, and we went through everything. And she immediately was able to diagnose me with panic disorder, and she said basically all those medications were wrong. They were never going to help me. She got me on a very specific medication plan, and she was checking in with me regularly as I was taking them and adjusting and tapering and all these things to really hone in on my specific issue.
Because the titration of these medications is really complicated. Obviously, there's the theoretical application, but then the subjective application of what is this going to do in this body this month, especially for women, especially in the postpartum period where hormones are already fluctuating and trying to rebalance, and breastfeeding hormones, you might have weaned your baby, you might still be breastfeeding, but literally monthly, it's titration has to happen. So a blanket prescription is not going to be the cure for this, which unfortunately many people are just given and walk away with.
Right. Yeah. And she asked me, what vitamins are you taking? I would like to see your blood work. So that was the first time, and this is, I'm thinking it was probably May, and then I think I tried to take notes. I think it was July that I finally was able to see her. I mean, this is weeks and months of seeking help and calling and doing all these things and finally seeing her. So this had been, a couple of months since this whole thing started, of everyday suffering, which feels like an eternity. And so this was the first person who sat with me and really heard me and listened to me and asked me these questions and went through my whole, like you said, specifically me, not just people who have this is what we give them. She was looking at my exact body type, like what I'm taking, what vitamins, and so I felt like, okay, this is the first person that's able to actually care for me. And here I am paying hundreds of dollars out of pocket because that was worth it, because that was really saving my life. But that was, and she was very mindful of that. She explained that. She said, we're going to space out appointments as much as we can, but also, we need to make sure that you get better.
I'm going to give you a Coast Guard analogy,
yes,
which is
please.
You were in the water, flailing, swallowing water, drowning, coming up for air, asking for help, and someone would grab your hand, but then it just wasn't right, and back down in the water, flailing, trying to survive. And finally a lifeboat comes along, and now you're on the lifeboat.
Yeah.
So you're out of the water, and there's some semblance of hope. Still, I don't know where we're going, but I'm just going to trust that you are going to pull me to safety. And I can actually, I can feel the hope in my body as you speak.
Yeah, it was very, I love that analogy. It really felt like I was flying and people were throwing me like an anchor. I'm like, this is not, what do you mean? Like this works for some people, I'm like, I'm drowning here. So yeah, I'm hanging on to this new lifeboat. And again, it's this expense that ultimately was worth it to us. But not a lot of people, some people aren't able to do that. And I recognize that I'm fortunate that I was even able to invest in my own, well-being in that way, really, my survival at that point. And so that began, I will say that wasn't even, it's not like a switch flips. It was still months before I really was able to function normally again. It's, because she was doing it the correct way, it was a slow progression into
slow.
Yes, slow. It wasn't just, here's a full dosage of this medication that, I don't know you, but try this. It was slow, and it was very mindful, and I was checking in with her constantly. She gave me a list of symptoms. It was just I felt finally very cared for months in. And And still I was having these panic attacks, but they started to become less frequent and a little more manageable. And so, ultimately I would say it was probably, I think it was November that I journaled that I finally kind of feel like myself again. So from May to November, every day it was, like you said, that's the time when you can lose people. And that was really, I can understand that because I was suffering every single day. And even once I got the help and we paid, we had to figure out budgeting, taking money out of savings to pay for this, to save my life, really. Even then, it wasn't immediate. It took time, and I had to check back in with her. And so I still see her. We still budget and pay out of pocket so that I can still check in and make sure, everything's going okay. And meanwhile, with my therapist, we were really working on the other end of it, which is sort of the mental, spiritual, how can I help myself? What sort of practices can I do? But at the time, you can't, necessarily sit and meditate while you're having panic attacks every day. It's really more of an emergency situation. Now I've sort of built from both ends. The medication really did, I think, help save my life. And then also the practices that I learned in therapy, both combined, really brought me back to being myself again. But, like you said, the system is so broken that that's not accessible for many people. And it breaks my heart. I think it's so sad because it's so needed and so many people don't get that. And I think about everything that I had to go through just to get that level of help and the support that I needed to survive enough to be able to get that help. And so I'm really lucky ultimately in this horrible situation that I came out of it the way that I did. And really, all of this is, in a nice package why I became a doula, because I thought once I finally was okay, years later, I need to go back in and I need to be one of the people that's fighting for the better way of doing this and giving that support that is so lacking. The statistics show that so many women experience something, maybe not to the extreme that I did, but they experience something, some, mood disorder, some issue. And the go-to is just figure it out yourself. That's what we're all working with. And it just doesn't line up. It doesn't make sense.
And when I train doulas, so many people think that let's talk specifically about the birth doula, it's so much about this natural birth or a water birth or an unmedicated birth and crystals and mantras and affirmations. And while often it can be, there's so much more to what a doula does. Most importantly, I feel, is that doulas are the boots on the ground. They are the people who see people during the pregnancy, during the delivery, and the postpartum period. And they are the ones that are like, something's not quite right here. Here's a referral. Here's a resource. And then you have the continuity of care, so then they can follow up and be like, hey, what happened with that resource? Oh, they didn't answer the phone? Let me call the person who gave me that resource and give you another one, or see why that phone wasn't answering. So the continuity of care brings that safety too. But the number of times someone has told me a doula saved my life, and I'm not talking medically, I'm talking by sheer observation. My doula said, hey, that wound doesn't look quite right. Let's take a picture and call your doctor. Or, hey, you haven't eaten since I saw you 2 days ago. What's going on? Because in our system currently, you have a baby. Sometimes your gynecological provider, your obstetrical provider will see you at the 2-week mark. A lot happens in that 2 weeks. A lot happens in that 2 weeks. Some obstetrical providers see you at 6 weeks. If the person is able to go, if the person has access to get to the appointment, which is a whole other story in and of itself. But between having a baby and 6 weeks postpartum feels like 6 years. Physically, emotionally, mentally, spiritually, hormonally, with everything. And so you get to your 6-week postpartum visit and your OB or your midwife says, so how are you doing? Good. You cried on the way here. You're probably going to cry on the way back. You've lost all your baby weight and more. And you're not coping. But at that moment in time, your blood pressure is fine, your laceration has healed, your vitals are normal, and your doctor gives you a clear bill of health and you're out. So it's really the doulas that are the bridge here. It's the doulas that are filling in where the medical system is not able to do give adequate care. And how beautiful that you're able to give back in that way. Tell me about as we begin to wrap up, tell me about the program at Cedars that you were involved in.
So I wasn't personally involved. My good friend, my social worker friend, she works with Cedars. She's a champion. I call her Wonder Woman. She really did kind of spearhead the perinatal mental health program through Cedars. And so she ran support groups. She provides resources. They're really doing things right over there in terms of caring. And so, she reached out to me after I, talked to her about this, and I actually sent her my story. And so she did a whole presentation about my story postpartum. And so she really did that to share. I think she did some kind of national speech. I can't remember offhand, but it was, I give her permission. I said, use my photo, whatever you want. I actually documented everything just to have and gave it all to her. And I said, if this can help somebody, you can use all of it. It's all there. There's so much more that we didn't even get to, but I wanted her to have that. And I continue to use that, when I go in to my practice as a doula. I don't give all these specific details, but I explain, where I'm coming from, and that I started doing this really because of my own experiences. And I come in being the person that I wish I had beside me. And then I tailor it specifically to my clients. Like you're saying, I get to know them. I get to know who they are. I'm coming in knowing this person had a birth trauma coming into this, and I know why. And I know what they're afraid of. I know what they're excited about. And so, when I'm in that space with them, whether it's in the birthing space or postpartum or both, I'm coming in knowing them so much more, and they know me so much more, and there's a trust built. Even after, they have the I'm drawing a blank on the name, the scale, the depressant.
Edinburgh.
Yes. Yeah. So that's sort of that. Many of us saw that and have filled it out. I remember filling it out in my kid's pediatrician's office, and I felt so strange doing it there because in those states of mind that I had been in postpartum, I remember thinking, what happens if I tell the truth? What are they going to do? Are they going to think I'm unfit? How is this doctor who's supposed to be taking care of my child going to help me? I don't know. And I think I wasn't really honest in those scales and that environment because it just didn't feel like the appropriate place. And I understand why they do it, but it also felt like, I don't know this person. They're taking care of my baby, and I have, given that scale, but I also talk through it with my clients. It's not just A, B, C, or D. It's really talking through what that means and what that looks like and how it can change. And maybe you felt like this, the last few days, but, or you felt okay today, but what about yesterday or the day before? When I'm here, I understand maybe you put on a different face than when I'm not here. Let's talk about that. And it's not just this kind of stale piece of paper that you can fill out, multiple choice. It's really, let's get to know the root of what's going on and find out what's under the surface. And no, I'm not, a mental health care professional. I'm not a clinician, but I can, like you said, I can help find resources.
You this can certainly screen. It is well within the scope of practice of a doula to screen for PMAD. And actually some changes are coming to the Edinburgh postnatal depression scale, which I'll talk about in another podcast. But there were some issues with it, although it's a great screening tool, where people didn't feel safe or felt like the doctor or the midwife or the OB was just giving it almost as a CYA, like cover my behind here, fill this out and we'll wrap up your case. And you got a 3, great, talk to you later because your score was less than 10. But what does a 3 mean? Was it really a 3? Did they take the time to talk to you about it? I know my own daughter got, I think, a 12 on that scale and was given that scale at her 6-week postpartum visit as she was finalizing billing in the front office. The medical assistant handed it to her and was like, here, fill this out on your way out. She filled it out. She got a 12 or a 14, I think, and was suffering gravely with postpartum anxiety and as a mental health professional herself. And
Wow.
the medical assistant sort of had this look like, oh, shoot, it's more than 10. Let me get the doctor. Knocks on the doctor's door. The doctor was with another patient. The doctor comes out, has one foot in the door, like, how can I help you? She shows her the score, and the doctor goes, oh, shit. Literally, oh, shit. Turns to my daughter and says, are you going to kill yourself?
Oh my gosh.
My daughter goes, no. And he goes, all right, we're good then. And went back in the room.
That's horrifying. Oh my gosh.
And we're talking raging postpartum anxiety, having had a baby, 2 months before COVID, et cetera, et cetera, et cetera. But what are we doing with that scale? Is it being used properly? And what do you do with a score of 0? Does anyone who just had a baby, do they have a 0? And how is the scale worded that's making them feel some kind of way? So the scale is great, but most importantly is the intention behind the scale, which is I'm seeing you, I'm watching, I'm here, I have resources, you're not alone. So giving you that lifeboat way sooner, right? Because you got Klonopin, you got antihistamine, you had a therapist who kind of knew, you got a therapist who knew, your husband was wonderful, but that true, like, I am pulling you out of the water, sit, and here's a blanket.
Yes.
And let me hold you while you're wet and shaking, and we will get to shore. Yep. That's what has to happen is what we're lacking. And I'm so grateful that our paths have crossed. I think you are incredible. I think you are a force in your community. Sondra's husband is in the Coast Guard. Thank you for your service. Thank him for his service, and for every person in the military is a family who's behind them. So very, very grateful to you, and looking forward to hearing more about your clients and your endeavors. And there will be resources in the show notes that I am actually going to have Sondra put some together, some postpartum and pregnancy resources for people to seek help. And I do hope you take a look at them. Sondra, thank you for joining me today.
Thank you so much for having me. This was great. It was great to see you.
Much love. Thanks for listening to the Mamatoosa podcast on the Industry Plant Podcast Network. Mamatoosa is hosted by me, Atusa Benji, and produced by Josh Stretton Carlson. Chris Agnew is our audio editor, and our theme music is composed by Mary Lalazarian. If you enjoyed the podcast, please consider leaving us a review and subscribing. See you next Tuesday.